I want to give you a high-level, brief um, update on the virus tonight, with particular attention to what it's doing in our area and how we can protect ourselves from this virus. Nationally and internationally, the COVID-19 case numbers continue to rise, but as you've heard so often in the news and elsewhere, the case numbers have leveled off, the daily increase in case numbers, so the curve is flattened. So the social distancing that we're accomplishing nationwide and worldwide is so far working pretty well. There's still lots of disease out there and still lots of increases. Virginia, 2,500 plus cases, new cases a day we're seeing. In our area, we are seeing an uptick in community spread, increasing numbers across our district. We are protected to some extent by the fact that we are rural communities, but that protection is in some of our communities is being defeated. And you can see the patterns that this virus actually takes if you look at the data from Three Rivers Health District. So in Middlesex, you guys, at this point, we only have 4 positive tested cases. That by no means reflects the amount of disease out there. One of the features of this virus is that a lot of people that have it have minimal symptoms or no symptoms at all. Estimates of asymptomatic spread of this or carriers of this virus range as high as 50, maybe higher percent of all people that have it have absolutely no symptoms, and a good deal more have minimal symptoms. So for every person who's sick with this disease, there are others that have no way to know they have it, and neither does anybody else. So anyway, in Middlesex, we have 4 cases, but you can see from the rest of our jurisdictions that is kind of a false sense of security. In Richmond County, we have 143 cases. That is due to a large number of cases in 2 aggregate and congregate care facilities, one correctional facility and a nursing home. And that clearly demonstrates how rapidly this virus can spread if it's in proximity, person to person. The virus spreads primarily by droplets from the respiratory tract that elaborate in the air when we breathe or cough or talk or sneeze or anything else. And the viruses remain there for a while and can be inhaled and encountered by other people in the environment. So let me tell you a little bit about what we've done with these congregate care facilities. They are highly vulnerable areas, so as soon as we see evidence of a potential outbreak, we have been able in the past few weeks to go and test virtually everybody in the facility. So by the time we have a couple of cases, we do one round of testing. Of course, if you test today, you don't get the results of the test until a couple of days later. That's the limitation of the nasopharyngeal swab test. But by the time we do the first round of testing, we'll see 60 to 70% of the total population of the facility already has the disease. And you test again a couple of days later, and it's up to 85% of the people in the facility have the disease. So this virus, given the right circumstances, can spread incredibly fast. And those facilities in Richmond County and facilities like that across the state have been, by definition, seeded from the community. So just a few cases that you know about in the community and all the ones that you don't know about that we know are there are enough to penetrate into these long-term, very highly vulnerable facilities and cause lots of cases. And those convert to hospitalizations and really bad outcomes. So a number of 4 COVID-tested positive patients and people in Middlesex is not reflective of the amount of disease that's out there. And that kind of gives us a false sense of security that is very false, okay? Our numbers in Virginia, day by day, have been rising a little bit. A lot of that is because we've been doing a lot of congregate care facility sort of testing. But in talking to my epidemiologist, Philip Carr, and looking at our data, we believe our community numbers are going up as well. So we're not out of the woods with this virus by any means. From a hospitalization perspective, we're still doing very good across the state. And so the metrics are trending toward at least trying to satisfy some of the conditions that have been set for reopening and for business to resume, which it must do. The virus itself is a very, as we said already, with asymptomatic spread, it's a very insidious virus. It also does things that no other pathogen that any of us have ever seen does. It causes a huge range of symptoms, from no symptoms at all to fulminant bilateral pneumonia and death. It can attack many systems in the body. And immunologically, it also does some very challenging things in a certain subset of people. There is encouraging information from the Department of Homeland Security that the type of light that we see in sunlight in summer and the conditions, temperature and humidity in summer, the thing has a shorter half-life, so it's harder for it to survive in the environment in those conditions. So we may see a little bit of help with that, with decreased transmission over the summer, which would be great because it would give us a chance to recover. My apologies. Still no treatments for this thing, and vaccines are in development everywhere. PPE and testing is getting a lot better, and you'll see in the coming days a testing strategy emerge from the governor's office and the central office of the VDH to accompany reopening our government and our businesses and reemerging in society. But going forward, it will be imperative to test liberally, and that'll be a mix of the nasopharyngeal swab tests we now use. That detects people who have the disease at the moment, who are actually shedding virus in their secretions from their nose and their mouth. The antibody tests, they tell you for the most part, who has already had the disease and who may have some immunity going forward. But those two types of testing will have to be done in great numbers, probably 10,000 plus a day, to really enhance our safety going forward. So in terms of going forward and reopening our businesses, it is, when we track this disease and we see how it's elaborating itself in these congregate care facilities, it's very, very evident that in places where people are not using strict personal protective equipment discipline, those are the places where the disease tends to take off faster. So clearly we're learning that the use of protective equipment, specifically masks, is extremely important in controlling the spread of this disease. So going forward, as we reopen, I think all of us are in agreement, from the national level down to the state and local level amongst public health authorities, that elements of social distancing, elements of protection, specifically adopting facial coverings, cloth face coverings, that's been recommended by the CDC. I would submit going forward, because the virus is going to be with us for the foreseeable future until we get a vaccine or we develop natural population immunity for this thing. That the cloth face coverings and the masks are extraordinarily useful in protecting folks. There are studies that show that if you talk and sneeze and cough without a mask, virus particles or aerosol droplets project many feet beyond the source of emission for somebody coughing or whatever. With a mask, just a tiny percentage of those droplets actually make it beyond the mask. So because we don't know who's sick, we don't know if we're sick or not, really. Many of us could have had COVID-19 and not even know it. If you're sick, it's pretty easy. You can go get tested. We can prove you do or you don't have COVID. But if you're not sick, you don't even know you to be tested. And we don't have the resources yet to test the population at large. So until we get a better source of immunity, and I'm going to say this is going to be, many, many months down the road, a year maybe, then these measures of sanitizing, washing hands, practicing respiratory etiquette, practicing as much social distancing as we practically can, And probably the most important element of this is it's called source control, and that's masking ourselves. It protects, you're really protecting not only yourself, but the people that you're with to reduce the spread of this disease. That's going to be an absolutely imperative part of coming out of isolation and going back into close association with each other. So that's pretty much my quick brief. That's very little information about the virus. I could talk for hours about it, but that's the brief, Mr. Chairman.
Well, thank you, Dr. Williams. Before I open up to my board members for questions, I'd just like to ask a question. When it's in the incubated period, you get tested, will you be tested negative?
So symptoms, people commonly start shedding virus. The people that become symptomatic, people commonly start shedding the virus about 2 days before symptoms appear. If you've been exposed, you obviously are either going to get the disease or not. The tricky thing is you may get the disease and not know it, and the only way to know it is actually to be tested. And eventually that will be more commonplace. But in the incubation period, if you develop the disease, you could very well start shedding the virus, okay, and not know it, and test positive maybe 2 or 3 days before your symptoms show up. So yes, you could very well be asymptomatic and test positive in your incubation period if you're in quarantine after an exposure. And usually about 2 weeks, if you have a close exposure to a COVID patient, we recommend quarantine for 2 weeks. And that is pretty much the outer limit of the incubation period of the virus.
Well, once you have it, can you get it again? I'm just questioning the question.
That is a very good question, sir. There are antibodies produced to this virus. We can see them and detect them. And there's actually a program through the American Red Cross and spearheaded by the Mayo Clinic to collect serum from people that have had this disease and try to administer that serum with antibodies to people who are desperately ill. The effectiveness of that treatment is not yet known. But whether or not you can be reinfected and have a second go-round with this, or a third go-round with this virus, that is not known at this point in time. But it's obviously a major concern. Most people think that there will be a degree of immunity conferred by infection. How long it lasts, how completely we're protected, those are questions that will only be answered over time.
Right. So to me, it just makes sense that, if you have a PPE or protection, you're not spreading it out, and also you're not breathing in, and you're protecting yourself and others. I guess that just kind of like make common sense.
Yes, sir. I cannot emphasize how dangerous this virus is and how insidious it is. In its worst expression, it is deadly. Granted, the vast majority of people that have it will recover, and some of them won't even know they ever had it. But in a subset of people, and especially those vulnerable folks that are older, have some comorbid conditions, but younger folks can have this outcome too. It can interact with your immune system. And 60,000 people, we just crossed 60,000 people in the United States have passed away from this virus. So it's not to be minimized, and anything we can do to protect ourselves against it, we should do. I will guarantee you that when I go out in public right now, I am wearing a mask.
Okay, I will turn it to any of my other board members who like to ask Dr. Williams a question.
Dr. Williams, this is John Kuntz in Hartfield. Thanks for your time and your very helpful explanation that so many of our community are listening to. My question is, as you've been working with your peers in other health districts, what have you seen in communities that has worked to encourage community members to take the mask wearing seriously? What are the best methods, and where are people doing this the best? What can we learn?
I would only be able to hazard a guess, sir, because I don't have any data that's extraordinarily difficult to to gather about mask wearing other than a gestalt, going out and looking in public venues and seeing how many people are wearing masks. All I can say is that in those areas where there are hundreds of cases of disease, you tend to see masks worn more frequently in those areas that are harder hit, where everybody can demonstrably see the effect of this. And those are our larger population centers. Okay, but in our area, honestly, we talk about this in the health department. We're trying to message mask wearing. We set up a Facebook page to try to get that message out. We see lots of people without masks, and the virus is no less deadly in Middlesex than it is in New York City or in Prince William or Alexandria or any of those, Fairfax or any of those other places.
Do you think it's fair to say that a lot of us who are monitoring our county on the VDH website watched us go from 2 cases to 3 cases to 4 cases, and we're using that information to convince ourselves that the problem's not as big as the problem really is? And as a result, the rural areas are probably not wearing masks. And I know you don't have data, but where people are seeing lots of cases, they're naturally responding by wearing the masks more so than in a rural place where we look at the VDH data, say we have 4 cases, and don't take it quite as seriously. Is that possible?
I think absolutely that's true. Yes, when you look at our website and you look at Middlesex and you see 4 cases, mind you, that is an illusion. That there's a lot more than 4 cases out there. I'll guarantee you there's a lot more than 4 cases out there in Middlesex. Every time you go to Lowe's, every time you go to Walmart, every time you go to the drugstore, you're going to pass somebody who has COVID-19. Absolutely. There's no question about it. And you don't know it and they don't know it. That's what's so dangerous. But all you have to do is look 2 rows down to Richmond County, and you can see who had similar community disease levels as Middlesex. But in that setting, with that level of community disease, that was enough for this virus to penetrate into those highly vulnerable areas. And now we have congregate facilities with bad outbreaks and hospitalization and intensive care unit cases and really bad outcomes. So don't let the seemingly low numbers fool you. That is an illusion. Reality is far more serious than what the low number apparently says.
And my last question, Doctor, if there were top 3 things that a citizen should be doing, it should be 1, stay at home as much as you can, 2, 6 feet, 3, mask. Is that the right order?
Currently, I would say yes, sir. When we emerge and go back to business, I would say stay at home as much as you can. Certainly will apply continually for the foreseeable future, certainly in phase 1, probably in phase 2 as well. For our older folks, our retired folks, and our folks with, hypertension, high blood pressure, hypertension, diabetes, kidney disease, lung disease, those sorts of things. Yes, I would say maintaining, no matter what, as we go forward, if it's possible, maintain, distance from other people, and wear a mask, wash your hands, and continue that discipline throughout our recovery phase. But yes, sir, I would agree with what you just said. Stay at home, practice social distancing, wear a mask. And the mask, I will say the mask is going to become much more important as we begin to mix together again. It's going to be imperative, in my opinion.
All right. And any other board members would like to have any questions for Dr. Williams?
No, but I would like to thank Dr. Williams for a very illuminating discussion. Thank you very much, sir.
My pleasure and honor, sir. And we'll be here to serve you and answer any questions anybody has. Thank you very much.
At this time, Matt Walker.
Yes, sir. I want to thank Dr. Williams for attending and giving the board an update. We've been talking behind the scenes here a little bit with some of the technical difficulties that we've had. It does seem like we're up against a pretty hard limit of I think we had a limit of 100, and we're well over that, according to Kevin Gentry, our IT director. I believe we have members of the public that want to listen in and can't because we're against that limit. I'm going to ask Heather to chime in on this one, but I think it's going to be our recommendation until we can accommodate all of the public that want to listen in. We may want to table this until tomorrow evening, maybe the same time at 6 o'clock, reconvene the meeting and have the discussion on the ordinance and any amendments or any changes that the board may want to make at that time when we have a higher limit. Been texting Kevin back and forth, and it appears we can pay for a little upgrade to the Zoom meeting and get more people involved and more people able to watch it live. And of course, if people have questions or comments, they can raise their hand and participate in the call. So I will defer to our attorney at this time and let her weigh in on that.
Thank you, Matt. This is Heather Lewis, County Attorney. Mr. Chairman and the rest of the board members, it is at your discretion. However, I'm in agreement with the County Administrator. I think seeing the level of public that is attending, and we welcome that, I hope they will continue to join us at these meetings. It would be recommended that we table this until tomorrow so we can address these technical issues. I was of a different understanding. I thought I didn't realize we had the cap, and so we need to talk to IT about that and make sure that's removed. I do understand from the comments that Kevin has been able to stream this to YouTube and to Facebook, so that's good. But with that, it is your decision, but I would support the recommendation to table this so that we can allow the public to listen and to participate.